Yes, I'll give you those updates, Trevor. Today's numbers are positive 102. Yesterday there were 100. Negative is 1,471, 128 pending, 74 recovered, total tested at 1,701. We've contacted 1,301. Our drive-through numbers are total calls 262, 9 positive, 78 negative, 25 pending, for a total of 112 tested. The National Guard mobile test collection is going to come back for another day of free testing. The date is this coming Sunday. The times will be from 9 a.m. to 5 p.m. To register, you can visit txcovidtest.org or call 512-883-2400. And the location will be at the Ector County Coliseum Barn C. And the health department is excited to share that around 73% of all confirmed cases are now recovered, and only one positive result has been reported from the National Guard testing. The use of masks and cloth face coverings in public is to protect others around you in the event that you are infected and have no symptoms. And remember, wearing a mask or face cover does not replace social distancing. And do not place mask or cloth face coverings on children under the age of 2 years old. Other news just for the county is installers, just please be patient with us, as we currently only have one designated representative who's able to do all the review applications and issue authorizations and conduct virtual inspections. So at this time, due to the overload of current applications, we're not taking any new applications right now, but we'll keep you updated as to when we can start taking applications again. And that's it for the health department, Trevor.
All right, thank you, Mr. Shelton. Russell, would you like to go over the MCHS numbers?
Yes, sir. Good afternoon, everybody. 893 total tested. 56 of those have been positive, and we have no new cases in the hospital. No positive patients in the hospital. I think we've gone, is it 6 days, Kristen? Is it 3 days? How many days have we gone without a patient like that?
We're broaching on 8 now.
So 8 days without a positive patient in the hospital, 812 negatives and 25 pending results. And again, there's no suspects in-house, and we haven't had a positive patient for 8 days. So we like that.
And Dr. Benton, would you like to go over real quick before I toss it over to Stacy the remdesivir shipment that will coming in this week sometime?
So yeah, we did get chosen at Medical Center to receive remdesivir. Not sure exactly the amount that we're getting, and it is supposed to arrive this week. Kristen, I don't know if we were expecting by the end of the week, right?
That's
so
correct.
That could be any day.
That's correct.
Awesome, that's good news there. Stacy, would you like to go over ORMC's numbers?
Certainly, thank you, Trevor. So far, ORMC has tested 344 individuals, still only 15 positive, so we've been holding at that number for also several days. 327 negative and only 2 pending. And we also do not have any COVID positive patients in-house. So that's my report.
Dr. Saravana?
Thank you, Trevor. Only thing I wanted to add for today is that there's a lot of videos that are circulating on social media talking about conspiracy theories about COVID, about the coronavirus, about certain people, even physicians in the profession, that are unwilling to really follow through with the social distancing guidelines and trying to encourage people to reopen and do things as if everything was normal. I do want to say that those are the vast minority, and the majority of the scientific community, as always, is going to band together behind the evidence that's out there. And so we want to keep reinforcing that people who are watching these one-off type of videos on social media look at it as researchers and look at the evidence out there. There's one video that maybe speaks very well on one topic, but there's probably 1,000 or more that support what it is we're trying to explain to the community. So that's what they should believe, the 1,000 or more that's out there with the evidence to back it up. I just wanted to make sure that we address that. Dr. Benton, do you have anything else you could add on that?
No, not a great detail other than I agree with you. I think we can be cautiously optimistic with what we see, what's going on in Ector County, right? Neither hospital has any patients. Still, with the increasing number of tests, it's still a ratio of 1 in 17 testing positive. So it would seem to imply that we have a low prevalence of the virus. However, it's still there. We still have to be cautious. We still have to follow our social distancing and wear our masks and be aware of it. Can I give you a quick update on antibody testing?
Absolutely.
So there are 377 signed up for the antibody testing. Very early results coming in show only about 3% positive, but we're only a fourth of the way into it. So, but that might be some early indication that the virus hasn't fully gone through the community, but it's too early to make any, to draw any conclusions completely from it. We still have a lot more tests coming.
Thank you, Dr. Ben. That's really good information. And somebody had just asked about the antibody testing results. So that's very, very good to know. Mayor Turner, would you like to add anything before we get to media questions, sir?
Sure. We had a call from the governor on Monday. He was talking about the allocation of revenue coming into the state. The state has about $11 billion from the Fed. The 6 largest cities in the state have already received their allocations, went directly to them, and everybody else has to apply to have their money sent to them. So we're in the process of application, and it looks like it's going to be a very long application, about 20% up front after your application. And so I will keep you up to date as that moves on.
All right, thank you for that, Mayor. It looks like we can get to media questions now. And first up, who I see on my list is Scott.
Good afternoon, everybody. Russell, my question is for you, please, sir. I've come across information that when the state task force got to Midland County to help the lodge out, they asked that all of their staff and all of their residents be tested for coronavirus, and they asked MMH to do that for them. And as I hear it, MMH refused, and then the state used you guys as a backup. Can you confirm that information?
This is the most recent, like last week.
Yes, sir.
Yeah, last week we got a call from our Amanda, our emergency management lady, and Kristen, if I slip up here, let me know, that she had received a call from the state that they wanted all of the Midland Lodge folks tested and their staff tested, like 160, 170 tests. And that they had reached out to Midland, and Midland told them that we have the contract for lab work for the lodge, so they needed to call us. And so they called us, and so our emergency response lady, of course, this all happens about 10 o'clock on a Saturday night, called us and said, hey, we need to deploy some nurses into Midland County. They've asked for 10 nurses to deploy from medical center into Midland County to the lodge. And I was like, oh man, hold on just a second, because that just does not sound right to me, because I just don't think that we need to deploy Ector County nurses into Midland County. So Kristen and myself and Dr. Benton were on a call, and I thought, you know what, this is crazy. Let me just call Mr. Myers. So I picked up the phone and I called Mr. Myers and I said, hey man, I said, do you know that the state is trying to do some testing at the lodge, and they've called y'all's emergency management person, and they referred it to us, and now they want me to deploy 10 nurses into your county. And you know, it just didn't sound right. And so he said, well, I don't know much about that, let me get back to you. And then Kristen and Dr. Benton and I started having some conversations, and Mr. Myers did call me back, and he said that he couldn't get a hold of his emergency management person, but he talked to his chief of staff, and they I guess they kicked it over to us. They sent it to us, and so we called the state. We called El Paso that night. I think, what was the lady's name? Wanda, it was her name or something like that,
Yes.
in El Paso.
Yes.
And said, hey, Wanda, what in the world is going on? And she said, well, the state wants that all those people tested, that they called Midland Memorial, and they told them that they were talking to the wrong people, that they need to talk to Medical Center. And we do have a contract with Foursquare, which I think owns Medical Lodge, but that's only to test the blood, the lab work once it gets here. That's not for us to go out and draw or swab the results, if you will, the test. And I told the lady from the state, I said, man, we just don't feel like we need to deploy Ector County assets into Midland County to test Midland County folks, that needs to be done in Midland. And she said that she could agree with that, but they were referred to us from Midland Memorial to handle that. And I told them, I said, I just don't feel right deploying Ector County folks and Ector County assets into Midland County. And so could they please refer that back to Mr. Myers and to Midland Memorial? And that was the last we'd heard of it. And so, and Kristen and Dr. Benton, if y'all remember that conversation any different, please feel free to chime in. But it was a very awkward call. And of course, Scott, again, those only happen on the weekends, you know, when everybody's off. But we just didn't feel like the taxpayers of Ector County should be paying to deploy things into Midland County. We just didn't. I didn't think that was right. I didn't want to upset anybody in Midland by us sending people over there, and just to receive this random call and, you know, on a Saturday evening that they want somebody to go over, that just didn't jive very well with us. And so that's why I reached out over there to make sure they knew that was going down.
And this may be out of your expertise, but what would something like 150, 160 tests cost the hospital?
Well, I can tell you that a test right now, just to get it tested, is anywhere from $70 to $100 each. And that's not including the manpower to send 10 people out there on a weekend after hours to get that done. So, you know, let's say 200 tests times $100 a piece, plus the manpower to do it. I mean, you know, it gets up there, especially when you're looking at, you know, everything we're going through with reducing services and furloughing people. And you know, I've made the comment before, patient safety and taxpayer dollars are at the top of my list. And I just felt like deploying our staff and our assets into another county, which just wasn't in the best interest of the citizens of Ector County. And it was kind of an awkward decision for us to have to make, but we just tried to do what we thought was best.
So Trevor, that's all I have. Thank you.
All right, thank you, Scott. Next up, looks like we have Danny.
All right, I have a couple of questions. One's for Mayor Turner.
Yes.
I are you going to increase 50% occupancy?
What we have done is we've actually rescinded our declaration of emergency, and going along with the state, I have not heard anything from Governor Abbott. Usually we get notification of a press conference or a conference call about 24 hours before. So we're waiting for that. So I'm expecting that probably tomorrow, because he usually does his press conferences on Fridays.
So any time when bars and gyms will be open?
The gyms are going to be open on Monday. He made that that call, I believe it was on the 5th. And so those are going to be open. There's a couple more on the website. I just checked it. It's going to be offices can open back up as long as they're using social distancing and things. But I haven't heard anything on the bars, and I haven't seen anything on the website either. So.
Thank you. I have one question for Commissioner Shelton. The Texas National Guard, are they coming back by invitation from the county? Can't hear you.
I think you're muted, Commissioner Shelton.
There we go. Yes, and you know, they've offered to provide another day, and we accepted. So we'll take it. And to register, I'll give you that address again. It's txcovidtest.org, or you can call 512-883-2400.
All right, thank you. That's all I have.
All right, thank you, Danny. Next up is Mike from the Odessa American.
I know I asked this question already before, but I had a request from some readers to see if we could get a number of active cases.
26, isn't it? It's confirmed minus recovery.
So do you mean active cases, as in the number of positive cases that are not listed as recovered?
Yes, sir. Yeah.
Okay, so that's just a math question. We could
change as far as knowing how that will be done in Ector County after that press release came out.
Well, Michael, the Texas Health and Human Services is going to work with a local entity to provide these tests, and they're working right now on when and how that's going to be done.
And Mike, just so you'll know, Dr. Saravan and I have been talking since that release. We spoke some yesterday. We're putting together a list of the nursing homes and the number of residents that they have and the number of staff members, just so that him and I also have that background in the event someone or something from the state doesn't pan out as quickly as what we hoped for as a city and county, so that Medical Center and ORMC can move forward and provide that assistance if and when it's needed.
Michael, you remember you asked about the cost question, and Scott, you asked again today as well. Remember I told you guys CPL charges us $70 per test, and then there's an overhead that we have to build onto it because of all the collection, the processing, the results, the communication that has to take place. When we created our initial charge account with Madison Medical Resort, Mike, I think that was your question from another day, is, you know, did the hospital sponsor the test, kind of thing, right? So it's not that the hospital sponsored the test, but our billing to Madison was at the lowest rate that we would normally bill out, which would be a Medicare rate. And that Medicare rate reimburses us $54 and change. So just so you know, for the tests that we did, we got paid $54 for each one of those, but our overall cost was the 70 plus our overhead. So around 100-ish was our cost. So yes, there was a part of it that we sponsored, but we felt the social need to do it. It was our contribution to what we thought we could do to help the community at that time. And that's what we will probably have to look at in the future and say, hey, if, like Commissioner Shelton said, if HHS mandates this testing, well, they can help pay for it, that'll be great. We'll be happy to be the people to do it. But we shouldn't do it at a loss every time because it's just a community service at that point.
Okay. And have those like prices for tests, have those gone down, say, since the beginning of April?
They have not changed for us.
Us either.
Okay. And are people supposed to be getting billed individually for their tests? I had someone who reported that in early April they did get a test and was billed $600 for it.
Right. So when a person walks in for a test with a doctor's order, they get registered. And remember, the cost of the test is not plain and simple. And I wish it was in the US, but healthcare billing is not plain and simple in the US. And this annoys doctors all the time, but it is what it is. It's the contracts that each insurance company has negotiated with a hospital, with a lab, with each service provider. And that's the whole bill that the patient ends up seeing. And what's billed is not what's paid. So you might get paid only 30% or 40% of what you actually bill. So you might end up sending this is really crazy in healthcare, but it's a known fact. You might send a bill for $1,000 and expect to receive only $200 of that $1,000 for the service that you provided. And that's the normal expectation. It's unbelievable that it's set up that way, but that's how insurance companies are set up in the US.
And Michael,
go ahead, Kristen.
I'm sorry. One point to your question is when at the beginning we were, at least I'm speaking on the medical center side, when a patient would go to the urgent care, they would be screened. And if they didn't meet all, then we would of course run that viral panel to rule out any other disease processes that may be going on. And so those cost of those viral panels were very expensive. And so prior to us releasing some of those restrictions and getting our PCRs and deciding not to do the viral panel testing prior to, I could very well see that someone would have gotten a bill for that because of that viral panel that we were running as a precursor to the actual COVID test.
Okay.
Well, and Michael, the drive-through testing is free because of generous contributions by local individuals and entities. And it's going so well that, and that's the reason why the National Guard wanted to come back again, because it went so well the first time and it was working so good that they gave us another pass.
Okay. And, this is for you, Eddie. Do you know how the, other county departments like the sheriff's office and the courthouse, do you know how they're getting PPE? Are they getting PPE?
Well, just through our normal providers, all of our vendors have stepped up to provide the PPE once they saw the need. I mean, and of course we're reaching out for it. If that's the question you're asking.
Yeah, I guess. I just wanted to know how that process looks. Do those individual departments reach out to you or someone in the county and then ask for PPE and then they will receive it, or how does that work?
We have a purchasing agent, and then the sheriff's department has this is the normal stuff that they have. They just need a whole lot more of it.
Right.
And then for the physical PPE, like the face shields and stuff like that we're putting in our public facilities and areas, they go through the building maintenance department. And of course, all of this COVID-19 stuff we're trying to charge to COVID-19 so that we'll have some sort of an idea of what the additional expense this has caused us.
Okay. All right. Well, thank you. That's
and
all
the sheriff's department also had donations, generous donations with their PPE. So the community is stepping up to help out.
Okay. All right.
Is that everything, Mike?
That's all for me. Thank you.
Okay. Just saw a question come through Facebook. I don't know if this would be for the commissioner or for mayor. Are stores like home improvement stores, Lowe's, Home Depot, are they having to abide by the 25% rule? Obviously, you've seen several complaints about people saying the stores are obviously packed. I drove by, they're packed. Are they supposed to be abiding by that, or are they under no restrictions currently? Do you know?
They are supposed to be following the guidelines of 25%. Unfortunately, on some of those stores, especially like Walmart and Sam's, the buildings are so big, the CO is quite a bit. I know the Walmarts, their certificate of occupancy is for about 3,100 people.
Okay.
So if you take 25% of that, and Lowe's and Home Depot are both large buildings, so they're allowed 25% of their CO. So
And
go ahead.
there's a waiting line to get in at most times. So I know they're attempting to abide by it.
Okay. I know that was just a concern I just saw on Facebook. And one other question I saw, just scroll through, do we know when bowling alleys are supposed to open? I would imagine that would go along the lines of bars, and with the bowling balls and everybody's hands touching them. Imagine that's going to be a while.
Waiting for the governor to give us some insight. I wished we could have a little more input here, but unfortunately, he has taken everything from the cities and the counties.
All right. Well, that's all I saw. Russell, before we go, do you want to give us some good words to leave on?
Yes, sir. I have one here that says, never stop praying, especially for others. Always pray by the power of the Spirit. Stay alert and keep praying for God's people. That's Ephesians 6:18 today.
All right. Thanks, Russell, and thanks everybody for being here. And again, we'll be off the press conference tomorrow. Numbers will still be released and everything. Another press conference coming back on Friday.